The vaccine debate is tearing families apart. It's even prompting hate mail to doctors in our area. Our Anusha Roy explores whether there is a healthier way for us to have these contentious conversations, because they're not about to end.
Dr. Richard Zane is an infectious disease specialist, tapped for his expertise on COVID more times than we can count.
We have to keep our eyes on.
He's also candid about trying to get people's attention.
I've been pretty forthright saying that being vaccinated is societal obligation and an act of patriotism.
That attention comes with backlash.
Really, what I truly believe, and we've spoken about it before, is you get vaccinated for a number of reasons. One is to protect yourself. The other is to protect society.
There was even an anonymous complaint about what he said on TV to the Medical Oversight Agency.
To the licensing agency.
And it goes beyond that one comment. UC Health stopped a program where they were automatically offering the vaccine to patients coming in through their emergency department because of how angry some people got. Instead, doctors and nurses are ready to give it if a patient asks for it.
If you have had to step in on any family conversation so far, yes, is the answer to that.
Dr. Jody Thomas has seen families debate each other too.
A lot of the decisions being made are around fears on both sides.
She's a psychologist and said the number one thing is to find common goals, which there are a lot of, even when fighting over vaccines.
We all would love to go back to doing the things we want to do effectively. We all would love our kids back in school safely.
To see those common goals, though, requires taking the temperature down.
That's what we really have to kind of challenge ourselves to do. The moment that we are taking a moment to truly be curious and wonder about that other person's perspective and being able to empathize.
Talking logistics, like what happens if a kid or a parent falls sick, brings that conversation back into more common territory.
How this impacts us and our lives and who we are specifically, rather than sort of this larger abstract tribalism idea.
So Dr. Thomas works with a lot of kids and families with medical conditions. And she said, especially with families with maybe divorced parents or just a lot of friction and things can't be resolved amongst themselves, that's when things start to go in front of a judge. And a lot of times the judge then is turning to the doctors to help resolve the issue. Kyle, we did also check in with a couple of other health systems locally. Some have anecdotally been hearing about this backlash, but said so far the good news is that hasn't happened to them.
So vaccines are not new. They're 200 plus years old. The idea of employers or schools mandating vaccines also not new, but this debate is challenging families in new ways.
Yeah, I mean, definitely we've had situations where parents may not be seeing eye to eye, but what's different this time around is the immediacy of it. It's about going to the grocery store, that birthday party on Saturday, or spending time with a parent who may be vaccinated or not vaccinated. And all of that, Kyle, has just been elevating these conversations and adding so many more layers of emotions to it.
Hopefully, if anybody can figure out how to talk civilly, it's family members, because let's face it, unlike the public, they hopefully love each other. All right, thank you, Anusha.